Nathan, thank you. We're just 3 days away from the start of the new school year, and right now there are more than 24,000 people with COVID-19 here in Arkansas. 2,318 new cases of the virus were reported yesterday. Since Monday, close to 9,000 Arkansans have been diagnosed with COVID. This week has not been good for our death toll either. 30 more people were added to that total yesterday, bringing it to 6,322. 1,396 people are battling the virus from a hospital right now, and while that's still very high, it is 50 fewer than the day before. We also want to take a closer look at those same numbers, but in our unvaccinated population. 84% of Arkansas's active cases have not had their shot. Since February 1st, 92% of those admitted to the hospital with COVID were unvaccinated, and 90% of our deaths since then were people who were not immunized. We've told you about one of the only successful therapies out there to help people with COVID-19, monoclonal antibody treatment. Up until now, you had to go to a hospital to get an infusion, but THV11's Mercedes McKay introduces us to the pharmacy becoming the only independent site in the state.
Westside Pharmacy in Benton opened up this infusion site on Monday and have already served 22 patients, and they're constantly getting calls for more.
Every day we just have more and more patients.
What once was an area where people got the shots that protect them from COVID has now turned into a site where people get treated for COVID.
We kind of came up with the idea last week, and we revamped this whole area.
After a local doctor reached out to Westside Pharmacy about the monoclonal antibody treatment, pharmacist Madison Schuler says they knew it was something they wanted to pursue.
We realized that there's a huge need in the community. The hospitals are just completely overwhelmed right now, and they have so many more COVID patients than they have infusion sites.
With help from local clinics, the Department of Health, and by local hospitals donating supplies, the pharmacy opened the infusion site in just 1 week, already taking 2 patients on day 1.
Realistically, we can have about 12 patients in here a day. The infusion takes about 20 to 25 minutes to complete, and then we have to observe the patients for an hour.
Physicians call the pharmacy when they have a COVID-positive patient who qualifies for the treatment. Schuler says those patients are seeing symptoms shortened by 4 days.
It's really best if patients can get in here like as soon as they start having symptoms and test positive. It can really prevent the virus from spreading.
Describing it as a win-win for all, Schuler says it's helping relieve crowded hospitals and sick patients.
We don't want our patients to go into the hospital. We don't want them to progress to having severe COVID. So our goal is to get people in here, get them treated early, and then help them stay healthy.
In Benton, Mercedes McKay, THV11 News.
If you've tested positive for COVID-19 and are at risk of progressing, Schuler says to see your physician. If they think you qualify, they'll write you a prescription to go to Westside and receive the treatment. Meanwhile, one of the state's largest hospital systems, CHI St Vincent, will require the COVID-19 vaccine for all of its employees. The CEO tells THV11 that months of discussion went into this decision. More than 70% of CHI St Vincent employees are already vaccinated, but Chief Medical Officer Dr. Jerry Jones says leadership understands there could still be some hesitancy to get the shot, so they're working to answer any questions.
You know, we recognize that this is a very difficult and personal decision and that people have questions. And so in making this, we've given ourselves sufficient time to be able to carry on conversations down to the individual coworker.
St. Vincent, November 1st to get their shot. You see video of Conway Regional right there. It announced on Thursday that it will also require the vaccine for all employees after its CEO said internal vaccination rates are simply not where they need to be. All employees must be vaccinated there by October 8th. About 7 million people in the U.S. are immunocompromised because of organ transplants, cancers, and other health issues. The Food and Drug Administration is now allowing certain people with severely weakened immune systems to get a 3rd dose of the COVID-19 vaccine for better protection. Michael George reports.
It's been 2 years since Keith Missimer's kidney transplant.
I'm back to normal again, just feeling great.
The 67-year-old received 2 doses of the COVID-19 vaccine, but learned he wasn't protected.
Think of all the people that had the shots, and they just simply believe that they're free from the virus, and they don't know whether they have antibodies or not.
Transplant patients and other immunocompromised people have less ability to fight off infections and may not get enough protection from vaccines. Now the FDA says some patients can get a third dose of the Pfizer or Moderna vaccine to boost immunity.
Achieving good immune protection from COVID in immunosuppressed people is going to be individualized.
Dr. Dori Segev is leading 2 studies at Johns Hopkins University testing the antibody response to a third dose in kidney transplant and autoimmune patients. His previous research shows fully vaccinated transplant patients are at much higher risk for a breakthrough COVID infection and hospitalization.
There can be a discussion between a patient and their physician, and they can make a decision based on the existing data of whether getting a booster dose is beneficial for them and worth any of the risks for them.
Dr. Segev also says while preliminary studies about booster doses are encouraging, we need more data. Keith received his third dose in the Hopkins study this week.
It hit me partway into that evening. When I was sleeping, I woke up and I had sore all over my body and my arm was hurting and I had a slight fever.
He'll soon find out if the third time is a charm. Michael George, CBS News, New York.
The FDA made no mention of compromised patients who received the single-dose Johnson & Johnson vaccine. If you or someone you know wants to learn more about how to get the vaccine or find a place to get one, just text the word vaccine to 501-376-1111. We'll send a link directly to your phone. Another big story today are mask requirements in schools, and more school districts across the state are choosing to implement mask requirements ahead of the new school year. Just this morning, Cabot announced a 30-day face covering policy, and last night the Little Rock School District in Jacksonville, North Pulaski voted to put measures in place as cases and hospitalizations continue to surge. As of this morning, we've learned of at least 20 districts that will be starting the new year with mask requirements. You can find the full list we've compiled right now on thv11.com. And with new mandates comes some big calls to bring back virtual learning. But that has some parents worried. Research shows that remote learning was not effective. In fact, grades lowered and did not improve until students returned to the classroom. Sharonda Lipscomb with UA Little Rock says virtual learning can be successful with proper preparation, but the first attempt at virtual classes did not come without its challenges.
Negative effects can be for K through 12, mainly that social interaction. Students are very engaged when they're in the online, in the face-to-face environment, but online can be a challenge for them, and that can impact the students' emotional health and well-being.
St. Mary's Regional Health System in Russellville shared a post on Facebook in support of in-person learning. Educators there say that they saw an increase in visits for anxiety, depression, and other mental health concerns across all age groups who utilized virtual instruction.